Good evening. Today I'll be discussing my project proposal on cognitive behavioral therapy affecting depressive symptoms. We investigated if indeed can cognitive behavioral therapy help treat depressive symptoms. The objectives of this study were to improve the quality of mental health services through prevention, education, and by providing access to appropriate treatment options for depressive symptoms in adults. The clinical problem that we identified was in adults how cognitive behavioral therapy compared to treatment as usual affects depressive symptoms within 6 weeks. During our research, we found out that in the United States, approximately 17.3 million adults aged 18 years or older have at least had one depressive episode in the year 2017. 64% of those adults have had severe impairment due to depressive symptoms. Cognitive behavioral therapy has been shown to be the golden standard of psychotherapy. Cognitive behavioral therapy, or CBT, has been shown to improve depressive symptoms in adults utilizing internet-based cognitive behavioral therapy in 3 level 1 meta-analysis studies that we found, in 1 systematic review and a qualitative study. The method in which we want to continue to investigate this problem is recruiting participants from the public via social media outlets such as Facebook, Instagram, Snapchat over a course of a month. Then we would take these participants and we would screen for depression in these adults aged 18 years or older for depressive symptoms with a patient health questionnaire 9. This PHQ-9 would screen adults for depressive symptoms based on the scores that they would get when they answered a question. Participants having a score 5 or higher on the PHQ-9 will be asked to sign a consent to participate in a study that is examining the efficacy of iCBT, or internet-based cognitive behavioral therapy. Participants will download the Get on iCBT software and do module of iCBT over a course of 6 weeks. At the end of the 6 weeks, individuals will be asked to take the PHQ-9 to evaluate their scores. Scores will be evaluated to determine if iCBT improved their depressive symptoms. During our implementation plan, we have a course of 6 weeks when we will be looking at the patients that we've recruited for the study. So based on that, we'll be doing the recruiting of the participants using the screening tool PHQ-9. Then we will ask them to download the Get on iCBT software. Then we will measure the improvement based on the PHQ-9 scores every week while they do the Get on iCBT software modules. And then at the end, we will be evaluating and examining the results of those PHQ-9 scores. The outcome measures that we want to achieve would be the PHQ-9 depression scores. What we would do is we would take the PHQ depression scores prior and post the iCBT. We would want to see a lower PHQ-9 questionnaire score after the iCBT in 6 weeks. Patients will report a decrease in depressive symptoms. We want to see an improvement in mood throughout the 6 weeks and a decrease in problematic behaviors and improvement in problem-solving behaviors. The implications and conclusions of the study would be that internet-based cognitive behavioral therapy is a great and effective tool to treat depression in adults. It allows patients to take charge of their own health. It gives them autonomy. It is cost-effective. Patients may not be as dependent on medications if iCBT is used as the first line of treatment. And also, the optimal treatment of depression in adults is iCBT coupled with meeting a therapist to increase the adherence to treatment and yield better outcomes. Thank you for listening to my presentation on can cognitive behavioral therapy help treat depressive symptoms. We hope to implement this plan one day and measure the effects. Thank you.